Mr. Chairman, thank you all for being here. I want to focus on our hospitals. So for you, Mr. Mazanik, one simple question I have is, who at HHS is our private sector supposed to work with in the event of a cyber attack?
Thank you, Congressman. So HHS brings a lot to the table in our SRMA responsibilities here, working with the sector. But in terms of the lead coordinating entity, it is ASPR, the Administration for Strategic Preparedness and Response, that is sort of the central quarterbacking function within the department. That being said, though, if anyone reaches out, as I mentioned in my opening statement, we have a weekly meeting with all the key entities across the department. If anyone is unsure of who to contact, and that's something we're looking to simplify and clarify for the sector, but if they reach out to any part of HHS, we are coordinating closely, and we'll make sure we get them connected to who they need to be connected with to address the issue.
All right, I didn't even have that on my list because we got Chief Information Officer. If we go to your website, we staff trying to research this before I ask you this. That wasn't even on my list. You got a Health Sector Cybersecurity Coordination Center. What is that?
So the Health Sector Cybersecurity Coordination Center, which we call HC3, is within the Office of the Chief Information Officer. It is a key repository of technical expertise and coordinates on and puts out information to the sector tailored to it from a threat perspective. Again, they're key participants and partners with us, with ASPR playing that.
But a hospital needs a 1-800 cyber attack number. Do they have that number?
So if they reached out to HC3, they would get...
How would they reach out to HC3? Like, do they go to your website? Like,
they have a web presence. We have the 405D program, which is another program established by Congress that engages a lot with the sector, has a very, I think, comprehensive web presence that is facing to the sector. But your question also indicates the importance of clarifying who they need to reach out to and engaging the sector. That's why some of these venues that I've mentioned previously, the Health Sector Coordinating Council, Joint Cybersecurity Working Group, is so important that we're engaging and touching the sector proactively so that we're not just waiting for them.
It's extremely important. That's why, for emergencies, we have a very simple number to call, 911. Right? It should be the same for this if your job is to help them. Another issue that concern that hospitals report is that regulators that they report to also have the ability to penalize them for reporting cyber attacks. They can turn around and get fined after they ask for help because of the possibility that private data was released, et cetera. So how do you resolve that?
So I think that is a concern where we've heard, and one of I think what they're referencing is the HIPAA security rule. Which is actually an incentive for the adoption of some of the best practices and resources we put out there. A covered entity under HIPAA, which I should note is not the entire sector, it's a subset of the sector that are covered by HIPAA. If they have a data breach and they can demonstrate that over the preceding 12 months they had implemented and taken due diligence to implement voluntarily some cyber hygiene best practices like the HICCUP that we put out or the cybersecurity framework, then that will have a mitigating effect on whatever penalty they might be subject to. So in fact, that regulatory role actually incentivizes the adoption of some of the best
ideally, practices. But it's also easy to imagine a different scenario wherein they didn't get around to it yet because they're busy, I don't know, doing hospital stuff. And so now they won't report these cyber attacks to you, and you can't add that to your database. You can't add these new attacks to your best practices. You can't help the people who you're designed to help because they're like, well, I'm not going to report anything to you. I'll get fined. So that's a problem that should be fixed. Okay, so two problems that need to be fixed. Mr. Kumar, DOE announced last year that they're putting $45 million into improving the security of American energy, in particular tools to protect the power grid. Can you just provide a quick update on what solutions have come out of this? It's very vague statements on the website. We can't find much information on what the plan is.
Representative, when we put out these funding announcements, what we do is we target them to threats. So what we do is we take threat intel to say, here are the priority areas for the research that we would like folks to actually submit their applications to. So we're looking at things like, how do new communications pathways create cyber risks? How do new emerging technologies such as AI and quantum could potentially impact the sector, and therefore we need to develop tools and technologies to defend against them. So again, all of our focus areas are mentioned in our funding announcements so that when someone submits it, and it could be an industry company, it could be academia, it could be a national laboratory, it could be universities as well, to say that they are going to submit for funding requests for that, and that's where the 45 million is focused on, and we're,
So it's a grant program?
It's a grant program, yes, sir.
For cyber defense companies to create the tools? Okay,
absolutely, sir.
got it. And I'm out of time. Thank you. I yield back.